I want to make this video today on the #1 most searched health condition on Google. Google can be quite telling on what's going on in America. The #1 most searched health condition right now is chronic fatigue syndrome. It is estimated over 2.5 million people in America have been diagnosed with chronic fatigue. Whether it means that people cannot even get out of bed and are non-functioning, to we just don't have that pep in our step anymore. I've seen people in severe chronic pain. And those chronic pain people, they say it's not always the pain that affects them the most. It's the fatigue. So I'm going to create a quick video on reasons why. Why do we have chronic fatigue syndrome? So yes, you are right. Hormones do play a role. We do not want to not look at that. Hormones play a role. Thyroid can play a role. But the #1 most overlooked, not even taken a peek at, are biotoxins and a chemical load on your body. Now, what are biotoxins? Epstein-Barr virus, cytomegalovirus. We have underlying bacterial infections, antibiotic-resistant bacterial infections, mold poisoning, heavy metal toxicity, whether that be from the fillings in your teeth, the fish we eat, or environmental resources or sources of those toxins. What happens is these toxins get inside of our cells. When they get inside of those cells become quarantined. So they're not in normal flow of everyday living, shall we say, in our body. They become quarantined, and a thick membrane occurs around that cell. When that thick membrane occurs around that cell, then the cells are not in a position to make ATP. They cannot make energy. Those toxins cannot get out of those cells. Truly, a whole cascade of very complicated events occur. But to make it very simple, here's the analogy I'm going to give you. I have a fancy car, but I can't get gasoline into it. Doesn't matter what we got. If we cannot get fuel into it, it will not work. So here we are, we have cells that are starved of energy. Over time, if that's left long enough, then our tissues become starved of energy. Continue that process, organ systems get starved of energy, thus giving us chronic fatigue syndrome. So what's our plan? The plan is to know what to test for, to determine if we have a biotoxic or chemical toxin load on your system, and a method of extraction, how to get rid of that. You can get your life back. This does not have to be your everyday life. There are solutions. I look very forward to hearing from you. I invite you to come in for a chronic fatigue syndrome assessment to see why your body is doing what it is. Thank you so much.